I just wanna know if you my friend. I just wanna know.
Sisters, brothers, whatever y'all want to call yourselves, we need to talk about these executive orders and how they're affecting nursing, the healthcare profession as a whole. I hope y'all got something to drink, child, because baby, we in for a long 4 years. Hi friends, and welcome back to my channel. If you're new here, I'm Kan, a board certified adult gerontology acute care nurse practitioner. Still trying to find a job, but anyway, today's menu, we're talking about the executive orders that I cannot call that name. You should not say that name, but we all know who we're talking about. The first thing he did when he got into office was rescind a whole bunch of executive orders that the Biden administration had put forward. He rescinded Executive Order 13995, which was an order that was prepared for us to be able to handle epidemics, pandemics, and to have a plan in place. Also to have a plan for recovery. Basically just an emergency response plan. Wiped it off first day. Now, how do you think that's going to affect nursing? In addition to that, he has paused all government agencies like FDA and the CDC to pause all communications with the public. This is in the middle of bird flu, H5N1, that's spreading like wildfire. Just last week or the week before last, China had human metapneumovirus. And then, I know I read this at the beginning of the week. I don't know, it was about January 15th, and they said something about the norovirus, which is basically just food poisoning, but it spreads like wildfire as well. At this point in time, I just don't think that's the right move to be making. You don't know it all. I know you think you know it all, but you don't know it all. Imagine how that's going to affect the health in this country. I don't even have to say it. We all been there. I was a nurse through the COVID. You weren't. Hopefully, I don't know if you're a nurse, but if you're a nurse and you're watching this and you worked through 2019 to 2020, we still haven't eradicated all COVID cases. Just a few months ago, people was getting community pneumonia. The FDA is recalling all of these things. Nobody's going to know about it. That's not crazy to y'all? What this man is doing in office is absolutely crazy. And I have a list here. I have a list. Just give me a minute. I have a list. This man has been in office for 4 days. And I've been taken down through there. All right. Of course, we know that a lot of those people that support this man don't even believe that's real. That's another issue that we've been battling for the past few years. As healthcare providers, I'm sure we all know just how frustrating it is. It's amazing to me that we have some healthcare providers who actually agree with that. It was a targeted approach to pandemic mitigation and emergency response and what we were going to be doing. Next executive order that he rescinded that really stood out to me was Executive Order 14009. That executive order by Joe Biden was created to strengthen the Affordable Care Act and expand Medicaid. And guess what? That's going to cause more problems. We have less access to care. We have more disparities in healthcare than ever. And me being from the Mississippi Delta, which is a big, huge healthcare desert, this has truly upset me. There were initiatives to expand coverage for postpartum mothers for an extended length of time, which we all know, like pregnancy starts at conception, and nobody talks about the last trimester, which is postpartum, and how many of us have suffered with postpartum depression. It's hard to get your pink back, if you know what I'm saying. It kind of changed some of the subsidies and made healthcare more accessible and better for those people who had to get Medicare or Medicaid. Allowed for states to expand their Medicare coverage. The last one, which we know is going to hit us hard, you guys. How many patients do we get in the hospital who have run out of insulin and now they're experiencing diabetic ketoacidosis? I know when I was working bedside, I had a patient like that every single week I went to work on an insulin drip. Reducing the cost of prescription drugs was Executive Order 14087 to make things that people need to survive easier to purchase. He just wiped it right out. Are you serious? Are you kidding me? Guess what? We're going to see more and more of those patients. Now, granted, I still did see a lot of those patients during the Biden administration, but I'm pretty sure we're going to be seeing a whole lot more. Insulin is not cheap. Now we have to talk about him withdrawing the United States from the World Health Organization. If you don't know, the World Health Organization has 3 goals. WHO has a goal of universal healthcare coverage. Another goal of theirs is protecting people better against health emergencies. And lastly, ensuring health and a healthy living for all ages, from birth to old age. Now, being that I did not vote for this person, and being that I know a lot of healthcare workers who probably did, and some that also didn't, just like me. This is a conversation that needs to be had, not to mention they're now rating the hospitals. They're allowed to rate the hospitals. They're allowed to rate the schools. How many people are going to be keeping their kids from school? How many people are going to be hiding instead of going to the hospital when they need help? Imagine the toll that it's going to take on healthcare as a whole. We've never seen anything like this. Not in this generation. But we might as well get ready, right? Comment your thoughts below. I don't know, you guys. We're in for a rough 4 years of this presidency. And honestly, that statistic that I said 1 million nurses are leaving bedside by 2027, this is going to boot them out the door a little bit quicker, because I don't know anybody who was satisfied working during the pandemic, regardless of how much money they were making. It was so hard to get up every single day and leave your family, not knowing if you were exposing them to viruses or all these other things. Like, we did not sign up for that. It's going to be a long and hard one. I love all my healthcare workers. I hope y'all love me. Nurses, we going to get through this. Comment your thoughts below and subscribe to my channel. We going to be all right. I don't know. That's all I got for y'all. Just saying.